Should my child take medication for selective mutism? Stay tuned. Hi, welcome back to my channel. I'm Anna Biavati, highly specialized speech and language therapist. Remember to subscribe for all the videos. Now, this is a very common question parents ask me. You might have heard about medication for anxiety and wondered whether it could help your child. Maybe you've been told that selective mutism is just shyness and it will go away on its own. You'll get more about this in this video. But deep down, you see your child struggling and you want to do everything possible to help them. So today, let's have a look at what the research says about medication for SM, when it might be considered, and what other effective strategies exist to help children build confidence and find their voice. If you've been following me for a while, you know that I explained to you that selective mutism is an anxiety-based condition. So selective mutism is not a choice. I cannot really say any more. It's an anxiety disorder, and research shows that children with selective mutism experience a freeze response when faced with a speaking situation, and selective mutism is a phobia of communication. Some of the most well-known researchers in this field, like Dr. Eliza Schipon-Blum and Dr. Stephen Kurtz, both from the USA, have studied how anxiety-based avoidance fuels selective mutism. So then what do we need to do is gradual exposure therapy is actually the most effective intervention. But Anna, what about medication? Some studies suggest the medication, especially SSRI, which is the Selective Serotonin Reuptake Inhibitors, that's a lot of a big word, like fluoxetine and sertraline, can help you reduce the overall anxiety level in children and in children with selective mutism. So, for example, Black and Hudd in 1994 found that fluoxetine helps some children with SM reduce their anxiety and increase the verbal communication. However, the effect varied and medication alone was not the cure. Another study done in 1996 found that a low dose of SSRI was helpful for children with severe SM when combined with behavioral therapy. However, Dr. Eliza and Dr. Kurt really agree that medication should never be the first line of treatment for SM. Instead, it is sometimes considered for children who have severe anxiety, are unable to make progress in therapy, and they have coexisting conditions like generalized anxiety disorder. Now, let's have a look together at the pros and cons of medication. So when doctors consider medication, they look obviously at the potential benefits, which these might be they may help children who are completely stuck and unable to engage in therapy. It can reduce generalized anxiety, making it easier for a child to practice their communication and their talking. And it can be useful for children who have extreme anxiety, like panic attacks, stomach aches, or severe avoidance. However, you need to take into consideration this part. It does not teach your child how to speak or when to speak. It reduces the anxiety. It can also have side effects like drowsiness, stomach ache, mood changes, and unfortunately, there are no long-term studies in the impact of SSRI in SM. And the goal is the gradual exposure. So we cannot just rely just on medication. So let's talk about though what we know and what works for selective mutism. We know that we have gradual exposure therapy. We take small, tiny steps to help children to practice speaking or communicating in a safe and controlled environment. In my method, which is the Brave Muscle method, I use a structured approach in helping children building their resilience and confidence, because being brave is a muscle and we just need to work through tiny little goals, not just speaking. And, we want children to understand that by facing and taking tiny little steps towards communication, so eye contact, waving, and then we build onto that. Now, in 2008, Orbeck and al. Found that CBT, so cognitive behavioral therapy, and structured exposure therapy are the most effective long-term treatment for SM. So really, when should you consider medication? So first of all, is the general rule of thumb is that if your child has mild to moderate SM, therapy should always be the first step. If your child has severe anxiety, and that is stopping them from engaging in therapy or doing anything else at all, then a doctor, a child psychiatrist, or a psychologist, a doctor might consider a very low dose of SSRI, and also depends on where you live. The UK is different from the USA, and so on and so forth. So medication is not a standalone solution, and it should be always combined with therapy that teaches your child to communicate gradually. Now, what I want you to know that I support parents in understanding SM, because we need to create the good environment and the right environment through Steps to Brave Talking, which then includes the Brave Muscle method. Now, for parents, it is such a big decision to think about the benefit of medication, but you really want to understand the ins and outs. Now, if you need any help, I'd love to help, so drop a comment below, or if you know anybody that might benefit from this video. And if you want more personalized guidance, feel free to reach out. I'm here, although my course is not open all year round. Now, don't forget to subscribe for more videos, comment and share, because I love to help you, to help your child, to find your child's resilience. And small steps build strong voices and powerful mind. I'll see you in the next video.